Good morning. Welcome and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. Yesterday, Maine reached several noteworthy milestones. We've reached the highest new cases per day at over 1,000 people newly diagnosed with COVID-19, and the highest number of COVID-19 hospitalizations across Maine at 280, and the highest positivity rate for testing, all highest since the pandemic started. This led to a change in availability of boosters in Maine. Boosters are immediately available to all people 18 years and older without restrictions. So the take-home message for dealing with this is vaccinate everyone, boosters for age 18 and over, if more than 6 months since last Pfizer or Moderna vaccine, and more than 2 months for J&J. And indoor masking if you'll be with people not living in your home. Today, our topics will include more of the latest on COVID-19, vaccines and children, everyone's mental health. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Dr. Cassandra Muldoon, a resident physician at Northern Light Eastern Maine Medical Center Family Medicine Residency Program, Chris McLaughlin, a licensed clinical social worker and Associate Vice President of Community and Pediatric Services at Northern Light Acadia Hospital, Jacqueline Carter, a certified family nurse practitioner at Northern Light Primary Care in Blue Hill. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation, and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Muldoon will start us off with a COVID-19 update. Dr. Muldoon?
Thank you, Dr. Gilkey. It's such a pleasure being here today. I have the distinguished pleasure of reviewing worldwide, nationwide, and statewide statistics and to talk about the future of COVID management. So without further ado, let's get started. This table here demonstrates the weekly trends in new cases around the world. Specifically, this table shows only 10 of the 202 countries currently reporting their new case data. As you can see, worldwide new cases have increased overall by 5% in the last week, but the United States has seen a decrease in new cases by 7% in the last week. This global trend is most closely tied to Europe's Delta Plus outbreak, with new cases in Germany increased by 49% in the last week alone. Conclusively, this demonstrates that the pandemic is not under control. Weekly trends look at past data, and community transmission is a way of looking into the future. As community spread or transmission increases, so too will the number of new cases. So this map looks at community transmission by county in the United States. Low to moderate transmission is in yellow. High transmission rates are in red. In the United States, the transmission is lower in the south and has been increasing in the north as colder weather is driving people indoors. Areas that are in red are places that will see the most new cases in coming weeks. Most notably, the North and Southwest are likely to see the highest rates of new cases. Let's zoom in now to Maine-specific data. The news has been talking a lot about different strains of COVID, but what does that really mean? Over time, the COVID virus has evolved to overcome our defenses. As we get smarter, so too does the virus. It can become more infectious, transmissible, and can affect different parts of our bodies differently. This slide looks super busy, but let's break it down together, okay? On the left, the second bar represents March of 2021, and subsequent bars show each successive month through to November. The red and blue color represents the Alpha variant, which took over here in Maine in spring from the original virus in gray. By July, you can see a huge shift in COVID variants away from the blue and red of the Alpha variant and towards our dominant variant now, which is the Delta variant in purple. Over the past few months, you can see the rose-colored AY substrains of the Delta variant rapidly taking over from its parent in purple. In the large grouping, AY is AY 4.2. In the news, AY 4.2 is called Delta Plus. Delta Plus is currently overtaking Delta in the UK as the most common strain. However, currently in the United States, it represents less than 1% of cases. The reason Delta Plus is in the news as much as it is that it's more transmissible than its parent strain, the Delta, and this explains the aggressive spread that we've been seeing over time. This is what's happening genetically with the COVID virus in Maine. It is very active. I also want you to see on the right that we're in this graph, we're looking at the various other strains and we're monitoring them around the world. Any one of these could potentially become a variant of concern and eventually outcompete Delta. Enough of the doom and gloom, though. There are 2 new medications for COVID-19 being used in Europe that are being considered for use in the United States. Molnupiravir was approved on the 4th of November for use in the UK. It was developed by Merck and functions by impairing the replication or stopping the copying of the COVID genes. In the UK, it is shown to half the rate of hospitalizations and mild to moderate infection. Paxlovid is still in clinical trial. It's being developed by Pfizer and boasts a decrease in hospitalization rate by a whopping 89%. It also works by impairing the replication or halting the copying of COVID genes. Currently, neither are approved for use in the United States, but both are being thoroughly investigated. Pre-approval orders have been placed by the American government. These are being heralded as potentially game changers in our quest to combat COVID-19. So in summary, we have this worldwide pandemic. It doesn't show any signs of slowing down as it continues to mutate. We currently do not have a treatment to stop the transmission or infectivity of the virus, but we do have measures for slowing it down. Like Dr. Gilkey had mentioned, everyone aged 5 and up should be vaccinated. Effective 2 days ago, per the Maine CDC, all Mainers aged 18 or older who have received Pfizer or Moderna are eligible for boosters if they are 6 months out of their original vaccine. And J&J, they're able to get the booster if they are 2 months out of their original vaccine. Monoclonal antibody treatment is available to prevent hospitalizations and death in high-risk people who are infected. This is available in the state of Maine and procured through either your PCP or through the Maine CDC directly. As we move into the holiday season, it is essential that distancing and masking are strictly observed, with serious consideration given to protecting high-risk individuals, namely those with advanced age or underlying medical conditions. One way to ensure this is to confirm that your guests are all fully vaccinated. The end is certainly not in sight, but between the vaccine, monoclonal antibodies, masking, distancing, and new medications being developed basically daily, we have great ways to manage the safety of our loved ones and ourselves, and hope certainly seems to be within our grasp. I look forward to answering any questions you may have during the Q&A session. Thank you.
Thank you, Dr. Muldoon. Next up is nurse practitioner Jackie Carter, who will speak about vaccines and children. Jackie?
Good morning. Thank you for the opportunity to discuss COVID vaccines in our children's population. I'd like to start off by providing some data for you, specifically why we should vaccinate this age group and some general information about the COVID vaccine. Initially, when COVID was emerging, the thought was that children were less likely to get sick and also less likely to transmit COVID disease. However, as the pandemic has progressed, we have found that low risk does not mean no risk. We don't have the ability to know what child will get COVID and die. 60 to 70% of kids that get MIS-C, which is the serious inflammatory complication of COVID in children, were otherwise healthy, not chronically ill children. Data has shown that 1 in every 3 or 4 children requires hospitalization and requires ICU care. Children are different from adults, but not that much. The ongoing data has shown over 300 million adult doses of vaccine have been given without rare side effects. And now we are almost a year from those first doses. Retrospective review of data is showing us that even with the Delta variant surging, people that were vaccinated, half of them, the admission was due to chronic underlying illnesses such as COPD that were not related to COVID, and only half of those admitted needed oxygen, continuing to show great benefit of vaccination. The Pfizer vaccine was approved on October 29th after a study of over 4,700 children ages 5 through 11 from the US, Finland, Poland, and Spain showed comparable data in prevention of COVID disease to the 16 through 25-year-old population. The 2-dose series, similar to the 12+ age group, has a timeline of 3 weeks apart. A lot of people are calling this the mini shot because the amount of the dose is 0.25 mLs, half of the 12+ age group. Age is the important marker of dosing, not weight, due to the basis of theoretical physiologic maturity. Recommendations are not to wait for this birthday milestone of the age of 12. For example, if your child is 11 and gets their first dose today, but turns 12 between these 3 weeks between doses, it is okay for them to get the full half ml or 30 microgram shot for the second shot. They may have a few more side effects, but the data continues to prove that vaccine is beneficial. So part of our job as providers is to give you not just the benefit, but also the risk of vaccination. Side effects are very similar and range from sore arm, headache, body aches, and fevers. There has been a lot of information passed around regarding the risk of myocarditis and pericarditis as a major serious risk, especially in children. Myocarditis and pericarditis are an inflammation in response to either an infection or some trigger that causes the muscle or pericardial sac to swell. That is the sac that is around the heart. Generally, this is characterized by chest pain, shortness of breath, and a pounding heart. Symptoms are generally short-lived, up to about 7 days, and resolve on their own, generally without intervention. These events happen in approximately 0.8 per 100,000 children every year, previous to COVID being a problem. The information from research across the globe is showing us this risk is relatively low with vaccination. The World Health Organization has provided data showing approximately 5 cases in over 1 million doses of vaccine administered. This risk is most common in male adolescents and young adult males, not in the younger population. The risk for vaccination and myocarditis or pericarditis associated with this pales in comparison to the risk of myocarditis or pericarditis after COVID disease. That risk is 16 times greater than the risk associated with vaccination. So as a parent, many concerns and questions arise with this new vaccine. This slide has a few of the common most asked questions and concerns that we see as primary care providers. A colleague of mine gave a great description of how an mRNA vaccine technology works. She said, it's like mailing a letter to yourself. You mail a letter which has all of the coding information that you need to get into your body. You put it in the mailbox, and when you receive that letter, you open it and process that information, coding. After you have read that letter, your body starts to process it and code that information. Then that letter is torn up and thrown away, never to be seen again. But that memory or coding remains in your brain. It's vivid. So when you are confronted with information that is incorrect, such as the COVID virus, your body remembers it and has the information to stop it or shut it down. Because there is no leftover material from the vaccination components, nothing will accumulate in the system that can cause or lead to long-term risk. Natural immunity is showing that it goes away after approximately 90 days. However, it is earlier in some cases. Vaccine data is showing us that antibodies last for approximately 6 months. Recommendations for vaccine after someone having COVID disease itself is still recommended, and the data shows us this essentially serves as a super booster, increasing the amount of antibody production. We are concerned about COVID parties, similar to what we saw in the 80s and 90s with chickenpox. This practice has been leading to surging numbers of hospitalizations, overload of the system, and deaths related to this practice. So our recommendation remains strongly that vaccine and vaccination is the best intervention for prevention. There are no contraindications in food allergies, medication, or even chronic illness, such as heart and lung conditions. And the only contraindication is an allergy to the component of the vaccine itself, which is very rare. Valid sources include healthychildren.org and your primary care provider as well. Please be cautious with internet and social media data and ask about validity of studies from someone you trust and someone who is educated in research study methods and data sciences. So when will this end? Until we find our threshold for vaccination and herd immunity, data is consistently evolving and being shared and updated. So stay tuned. Breakthrough cases do happen, but I really want to emphasize that vaccines do a number of different things to protect you and others. The main function of vaccines is to protect you against getting the disease. The second function is to prevent complications, hospitalization, and death if you do get this disease. A shorter disease course is included in this function, and the evidence shows us that a 3 to 6 day course of the disease, if you are vaccinated, is generally the case compared to 13 to 18 days in non-vaccinated persons. The third thing that vaccines do is they reduce the transmission of the infection of the virus from one person to the next by reducing viral shedding time, as well as the amount of virus that you have in your nose and throat that you are shedding and potentially transmitting. There's also less density of the virus in you and less risk that you are transmitting to someone else. Resources to assist you in gathering and decision-making that are valid are important. Navigating the internet can be tricky. Please use valid sources and ask your trusted healthcare providers and other professionals to help you interpret the data safely and confidently. The American Academy of Pediatrics has a great website with lots of information, resources for parents. And recently, a panel of pediatric providers in our state hosted a webinar earlier this month regarding vaccinations in our pediatric population. This was very informational, and I highly encourage anyone with questions to please check this out. I've included a link on this slide for you.
Well, thank you, Jackie. And slide up here helps you understand how to access primary care locations and pediatric care locations across Maine with Northern Light Health. Next is clinical social worker Chris McLaughlin, who will speak about mental health and the upcoming holidays. Chris?
Good morning, Dr. Gilkey. Thank you so much. It's a real honor and privilege to be with you all again today for these series, and to be with colleagues that are just, their expertise just blows my mind. So it's a real privilege to be with folks today. I wanted to start by providing some guidelines for how to best support youth across all different age groups when it comes to navigating the challenging world of holidays in a pandemic. Some of these are also tips and tricks that I talked about last year, but also have added some new ideas as we navigate the challenges of the holidays coming our way. So for 0 to 3-year-olds, I really want to encourage parents and caregivers to take off that pressure, really keep things simple. Give yourself that permission to scale back on gifts and elaborate celebrations, even elaborate decorations. What kids of this age need most from you is your attention, some quiet time together, and lots of snuggles. For 4 to 6-year-olds, this is a great time to start focusing on creating new traditions, to build your own family's new way of approaching the holidays, trying some different crafts, making some different meals together, and encouraging those 4 to 6-year-olds to help out in the kitchen where they can. It's also important with this age group to start that validation process that what they're feeling, their sadness, their frustration, their disappointment, and yes, maybe even their anger at the situation is absolutely okay. It's normal and it's to be expected. This is also the age group where we want to start focusing on the positives wherever we can. So for families that are used to traveling a whole lot on the holidays, maybe reminding kids that it's really special to be able to stay in your own home and enjoy the company, stay in your pajamas with one another all day long. Something positive that might come with these changes. For 6 to 12 years old, yes, validating those same feelings is really, really important. And get those kids engaged in coming up with their own ideas of how the holidays can be made more special this year. Get their buy-in, get their participation, get their suggestions, and really get them involved in the process. This is also a good age group to start really emphasizing those self-care relaxation strategies together, finding those favorite movies or television shows, finding your favorite storybooks, or even Christmas albums that you might want to listen to together as a family. Get in the car, go look at lights around the neighborhood, try some of those nice low energy relaxation traditions together. For adolescents of all ages, we also want to make sure that you're checking in, whether verbally or non-verbally, with your teens to just make sure that they're doing as best as they can. When I talk about nonverbal check-ins, this might look like leaving Post-its for one another or notes, or encouraging your teen to embrace some color-coded strategies to their wardrobes. So when your adolescent is wearing the red sweatshirt, maybe they're not doing so hot today, but the green or blue sweatshirt is all systems go and they're feeling okay. Adolescents need a lot of voice and choice in everything they do, and the holidays is really no exception. So give them choices where they can. And this is a perfect age group to get them more civic action minded and involved in the community, maybe collecting donations or doing a food or can drive, or even doing some letter writings for kids or older patients who are not able to be out of the hospital or in the community. This is a great age group to get them working on that spirit of giving and charity. For parents, though, I really want to emphasize this image that I've talked about before. You've heard me talk about this before. This is that image that I've borrowed heavily from our friends and colleagues in the airline industry, because what this industry has known for a very long time, dare I say longer than even those of us in behavioral or primary health care, what they've known is that in times of crisis, if the adult in charge is not well cared for, kids can be in jeopardy. And that rings true as much today in 2021 as it has all through 2020. And as my colleagues pointed out just a little bit ago, what we need to continue to think about going forward even into 2022. So this idea of securing your oxygen mask, parents and caregivers, teachers and educators, is a real important one. And part, especially in the holidays right now, part of adults securing their oxygen mask is being reminded that it's okay to do things different, to take off the guilt and the shame of doing holidays in a different way. Parents, caregivers, allow yourself to feel sad. Allow yourself to feel worried and angry, just like you're validating in your youth. Do something to nurture yourself, play around with those expectations, adjust your own idea of what the holidays should or could look like. Stay focused on the big picture about holidays are about together time and family, however you define that. Remember, kids take their cues from their parents. And so parents and caregivers, if you're maintaining a positive, festive, and calm demeanor, kids are going to pick up on that and do exactly the same thing. As long as your own oxygen mask is secured and your oxygen is flowing, whatever that means to you, your kids are going to be just fine. So I talked about creating new traditions, and I titled this slide Part 2 because I had this conversation with many of you last year at this time as we were thinking about the 2020 holidays. And here we are a year later, and we're still talking about how is this going to look different than what we typically have expected. I really like this quote from A.A. Milne, who many of you know is the creator of Winnie the Pooh. And Mill writes, "We didn't realize we were making memories. We just knew we were having fun." And for me, that really sums up the spirit of the holidays, especially the holidays during a global pandemic, better than anything I could ever offer to you. It's really about having fun. And in the act of having fun, those memories are being made. So, what are some ways you can have some fun? Embrace that technology. Bring your dining rooms together. Do some viewing parties for holiday football or other sporting events and parades. Organize some online shopping together. Get households clustered and just spend time together. And I love the advancements that even in just the last year, we've seen in Zoom and other video platforms that now allow you to rearrange your view so it literally looks like you're sitting around a dining room table or sitting in front of a fireplace together. Embrace that. Embrace the filters and get the reindeer noses and the antlers on your pictures and just have fun. Be silly with the technology. Community connections. This is that idea of staying really, really embedded in the sense of community, the sense of giving back, and the sense of charity. So creating Thanksgiving meals to go or doing drop-off, ways to share meals and recipes that don't involve all physically being together. Remember, this is the season of giving, and there are angel trees both real in person or electronic virtual giving trees that are representing families from all over our state who are in time of great need, especially with the financial implications of the second year of this pandemic. So encourage kids to find ways, whether it's sharing their own used or gently used toys that they can donate to any number of charities, or food banks or food pantries that really need our support this time of year. Contactless gift exchanges, leaving homemade treats on neighborhood porches, all ways that we can give and really reinforce that sense of giving. I really like the idea of embracing some friendly competition during the holiday season. What do I mean by that? Decoration contests, who can collect the most canned goods between offices or workplaces, or even within a neighborhood or a community group. And again, make memories, have fun, maybe record a TikTok challenge, do some funny dances, do a funny lip sync, and challenge your friends and family all over the country, all over the world to participate in this with you. And maybe you can create one of those viral fun moments. And then finally, mix up the recipe. And I've talked about this before. This might be the time to not worry so much about what the food is at the table, on the table, or embracing those large meals of times before COVID, and really think about what is my family, what are the comfort foods that my family loves? What are the fun desserts and favorite meals of each of the members of this family or this household? And how can we, again, create that special fun memory moment using food and the process of cooking food together as the catalyst for that event? I want to pivot now, though, to another conversation that I've been thinking a lot about as we've rolled into these holidays. And it's really about this idea of how to manage challenging conversations. Even in the best of times, the holidays are sometimes fraught with family conflict, figuring out who's hosting or who's not hosting, who's invited or who's not invited at certain places this year. And so there's so much stress and chaos sometimes involved in the holidays that we can lose sight of what are the best practices around managing tough discussions. So as some reminders here, I wanted to give you sort of my top 4 of how I personally try to embrace these challenging conversations and tackle them head on. It starts with setting clear limits and managing my expectations. What do I want from the conversation? What am I willing to negotiate? What are my non-negotiables? Where is that line in the sand drawn? And I have to really check myself. How firm is that line? Just because I think that's a non-negotiable, is it really? Can I give a little bit different or more? And what are my expectations in the discussion? That's an important place to start. I also need that reminder to remain judgment free. Everybody's family, everybody's household is just a little bit different, and that's okay. And rules and expectations for one household may look very different from another. And perhaps we all have our own family personal examples of how we might think about masks or vaccinations, and that might not match other members of our family. And so while we might have clear limits around what we can and cannot negotiate with around masking and vaccinations, it's really important that we still remain judgment free and try to remember that people are doing the best that they can with the information they have available to them in that moment. This doesn't come from a mean-spirited place. It comes from a place of parents and caregivers doing what they think is in the best interest for their family and the youth in their home. And that may not match what my opinion is. Therefore, we need to maintain good boundaries. Again, it comes down to that idea of compromise. It's okay to enforce those boundaries, to say what you are and are not willing to do or have happened during the holidays, who is or is not welcome in your home during the holidays. But it's so important that we do that with kindness and that we remember that these are tough conversations, they're tough situations, and we want to make sure that we're being as kind and patient as we can be. And finally, let's validate those challenges. Again, everybody is going through this really long, extended period of loss connected to this pandemic. And so we can validate, we can acknowledge that this is really hard for my family and it's really hard for your family. And we can share empathy. We can acknowledge that there is loss associated with doing Thanksgiving or the December holidays different this year, just like last year. That doesn't necessarily change our boundary. That doesn't change our limit or the expectation we have around what's right for our family. But empathy will always, always win the day. With that, I want to also share this other, I think, connected idea of the reality happening around our state, our communities, and even our country right now. COVID continues to create challenges in schools, community centers, daycares, and really any place where kids have gathered. I know that this has been a really frustrating time for parents and caregivers and educators and providers, but yes, also kids. So as adults, I want to challenge us to remember that kids are really at the center of what we're talking about here. They are experiencing these challenges firsthand. These moves to remote learning, cancellations of events and special gatherings, rites of passage in the world of kids, closings and other disruptions to everyday life are bringing this continued sense of loss and the grief that's connected to that loss to the forefront of the kids' lives each and every day. It's been tough for adults, but I promise you, it's been really tough on kids. And I worry that somewhere along the way, in the spirit of advocacy or in the spirit of being a voice for youth, many adults have perhaps lost sense of what's really important here. I've seen news stories just like you all, both local and national, about civil unrest, angry outbursts, disruptions happening at school board meetings, at town halls, and yep, even on the streets in front of schools and daycares. And I just think we can do better. I want us to get back to the basics of really all I really needed to know I learned in kindergarten. Robert Fulgram's really essential book around getting back to basics, getting back to those lessons that we all learned as kids, playing fair, keeping their hands to ourselves, saying that we're sorry when we hurt somebody's feelings or hurt their bodies, clean up after our own messes, and yes, even washing our hands before we eat. These are the lessons that we must keep reminding ourselves about. Because here's the deal. Kids are watching. They're learning. They're paying close attention to us, and they're waiting to see how the adults around them are going to respond to the challenges that are being thrown our way. They're listening. So here's my challenge to you. As a community, let's make sure that the stuff that kids are seeing the most of are all the things that we want them to embrace and master in their own lives. This is a really tough time, and we've got to keep that kid perspective at the forefront. Kindness, empathy, compassion, and resiliency. That's really what I want to reinforce during this really tough holiday time. Thank you so much, and I'm happy to answer questions and talk more as we finish out our hour together.
Thank you, Chris. For this next segment, we will ask our panelists to join on video and to answer your questions. Just a reminder to place your questions in the Q&A box. The first question is for Dr. Muldoon. Why do you think the number of new cases is so high in the northern states now, in spite of progressively more people getting vaccinated?
That's a really great question. And I think the answer is multifactorial. Certainly with winter months coming in, the cold setting in, folks are moving indoors. There are new strains that have become more infectious that are permeating our community. But overpinning these things is folks have become a little bit more lax in distancing and masking in public spaces. And also we're running to the end of our vaccination efficacy. We're getting to that place where we all need boosters. Certainly folks have been vaccinated, but the next step is now a booster. There is data around the length of duration of the efficacy of vaccines. Both Pfizer and Moderna have released data stipulating that, by that 5 to 6 month out of your initial, your first round of vaccines, that we've dropped down to the 80s in terms of efficacy. And so that also is playing into this thing. But at the end of the day, it is multifactorial.
Yeah, thank you. So I'll just follow up with that, Dr. Muldoon, pointing out that I was focusing on some data that I was reading about yesterday, that the natural infection from COVID creates an immune response that seems to be waning in about 2 to 3 months. And then, like you were just saying, somewhere around 6 months for the vaccinations of Pfizer and Moderna. I'm not clear about that 2-month window for J&J, so it suggests that maybe there actually needs to be a boost a little bit earlier in the J&J. So putting that together with the data that I shared with at the beginning of our presentation today, are you thinking that the boosters are becoming available so quickly like this because of that waning immunity?
I think that's exactly it, Dr. Gilkey. With waning immunity, with our first round of vaccinations, this increase in cases, and the new strains that are coming through that are more transmissible, more infective, we're finding that we need more immunity. We need that booster. When we look at higher level, scientific models that are not specific to the vaccines that we're looking at right now, if we take on that the initial vaccine effectiveness was about 90% within 250 days post-vaccination, not taking into consideration specific population data, but just that high level data, it should drop by 20%. We're seeing in the numbers if initially we were 91% effective at this 5-month marker with Moderna, they're saying that they're only 84% effective. And Pfizer is saying that they're between 80 and 92% effective. But we're seeing precipitous drops. And for folks that got their vaccines early on, we're over a year out from initial vaccine booster deadlines now. So I think we are more than due for this. And I think that appropriately, the Maine CDC is reacting to that.
So let me ask you a real world question. This one's coming from me specifically. So in seeing your patients, understanding that we're moving into, the gatherings of Thanksgiving and other holiday events. People really, I'll speak for my own family. People are desperate to get together. They really want to do this, and it seems like we've all collectively took a deep breath, a sigh, and let down our guard. We're not really seeing a whole lot of masking in public places like we had a year ago. Clearly, what are you recommending regarding boosters to your patients that you see pretty much every day?
Dr. Gilkey, I think you're hitting on a really important point, and I think Chris has hit on this as well. This idea that we don't exist in silo, right? Like we are biological, we are social, and we are psychological beings. The biopsychosocial, and so the biological imperative is that we be protected from this thing, right? In order to do this safely, because we can't interact if we aren't alive. So the protection is getting vaccinated 6 months if you're Pfizer or Moderna vaccinated, getting that booster if you're 2 months out of your J&J, getting that booster to do this thing safely. If you are an elderly person or somebody who has underlying medical conditions, it is imperative that you continue to protect yourself with masking and distancing. Does that mean not attending these essentially vital parts of our social constructs, our social networks? Absolutely not. I think that we can do both of those things, but we have to be mindful to do them safely, keeping a safe distance, making sure that who we are interacting with, that these people are also vaccinated, that they are protecting us with their vaccination statuses, that they too are wearing masks, that they are sitting at an appropriate distance. Just as it is, the host's responsibility to make sure that folks that are attending these events are vaccinated, I think it's also our personal responsibility to ensure that these places, these public spaces that we are occupying, that they are also safe for us. Does that adequately answer your question, Dr. Gilkey?
Absolutely. I appreciate it, Kathy. Jackie, I'm going to kind of continue the thought process here and ask you a similar question. So, you're seeing a lot of folks, including a pediatric population. It's been very dynamic. All this information, the 5 to 11-year-olds are now able to get vaccinated. And now we have this, new information about boosters being so readily available. What are you recommending to your patients?
At this time, anyone in that 5 through 11 and 12 through 18 group, they haven't come out with a booster recommendation at this point. So we're strictly focusing on getting the primary series taken care of, getting those first 2 shots done for these children. A lot of education and a lot of talk, again, like Dr. Muldoon said, about continuing to socially distance, continue to mask wear, encouraging patients with any symptoms at all, just get tested, don't hesitate. So the primary focus is still just get the basic series.
So get that basic series, as appropriate, jump on the boosters. And then let's not forget about letting down our guard and get back to the basics as you're talking about with the masking and distancing. I think that's what I heard, right?
Yes, absolutely. Boosters for kids from 5 to 18 are going to be data that's going to be evolving and coming. And I'm sure that once we have more information on that, we'll be able to disseminate that. But for now, we just want to get people safe by getting them vaccinated.
Yeah, I think you're right. Probably the next cohort will be ages 12 to 17 that we'll be looking at, just as the way it was rolled out originally. And then, because we'll be having the primary series of 5 to 11, we probably have breathing room for them regarding boosters. Yeah, great. Well, that's really important points. Jackie, I have another question for you. Many people seem worried that the vaccines may have long-term consequences for young school-age children. With no experience beyond the recent clinical trials, how do we know nothing will happen long-term?
That's an excellent question. We get that a lot as healthcare providers. The easiest way to discuss this is the mailing the letter analogy. There's no remnants of vaccine components that remain in the body. The vaccine is designed to get in, stimulate the antibody production, and get out of the system. Sometimes the vaccine components are leaving 24, 48 hours at the most. I think one study said at the most a week. And so therefore, based on that principle, the risk for long-term effects are very, very unlikely. We've given so many 300 million doses to adults without any of these major long-term effects at this point, that the data just continues to verify this theory behind that.
Yeah, that sounds so important to have people understand. Like, people are concerned about putting a foreign body into their, system, like getting the vaccine. I don't want that foreign stuff in there, right? Do they really know what it's going to do long term and all that? But the point is, the way the body handles it, it creates that immune memory, which is our own creation. It's our own body's response, and then that foreign body, that vaccine, is gone. It's not around to like do anything else, right?
That's correct. That's correct.
Well, I think that's important for all of us to understand. Thank you. The next question is for Chris. We go into restaurants and most people don't have masks. In school, the children wear masks. They want to have sleepovers. Yes to sleepovers, no to sleepovers, wear masks, no masks. How do we define consistency in all this for the children?
Yeah, that's a great question. And I love what I'm hearing from both of my medical colleagues here around balancing those all aspects of our existence that for many of us, including for kids, that social piece can be just as important as all these other pieces like their health. But I think what's important to draw from is this idea that even before the pandemic, kids have had to navigate different rules in different places before. And I think about sleepovers before the pandemic, where one family's rules might look very different than another family's rules. Some families are a shoe off household, other houses are shoes on. Some may say a blessing or a prayer before bedtime or before a meal. Other families don't do that. And so as a guest in those families' homes, parents and caregivers have always encouraged kids to be respectful, to be polite, and to embrace the traditions of the host where they're staying. I think masking is also very similar to that kids understand that in different settings, different rules apply. Even in their schools, the way that the kids behave in a school library is very different than how they behave in a gymnasium or out to recess. And my math teacher might allow me to do this, but my English teacher doesn't allow me to do that. And so I think just putting it in these kind of layperson's terms and tapping in to what kids already know, that while we as adults, some of us really crave, I'm one of these people, crave consistency and crave these more black and white answers, that's just not the world we live in, especially during this pandemic. And so reminding kids that rules are different. Each place might have different rules or expectations, just like their friends' houses might have different rules and expectations. And so, as Dr. Muldoon shared, for these kids and sleepovers, does this pandemic mean that kids can never do a sleepover? Absolutely not. But parents and caregivers have got to be talking to one another and checking in. Is the expectation that there's a vaccine in place or a booster for those available? Those are transparent conversations. And I go back to the pieces I shared around navigating tough conversations, parent to parent, talking about what the expectations are, keeping judgment free, and keeping that kindness and empathy at the forefront.
Thanks, Chris. I have a follow-up question that's kind of related, talking about the behaviors. With all the limits on children, what are some ways to correct bad behaviors? I'm especially concerned about taking away technology when it connects them to their friends. So, I think you helped us understand how we could really embrace that technology. Yet, I think that's one of the main things that parents use in terms of bad behavior management. So, what's your take on all that?
Yeah. So I'm also guilty of being one of those social workers that for years before the pandemic cautioned parents about screen time and encouraged families to know what your kids were doing online and to really set some limits and some family rules and expectations around screen time. And then this pandemic hit and the families that I'm connected to, now what? And don't want to be hypocritical and mix that up. I would say, so what I have said to families and what I would continue to say is to really look at technology as a replacement, a stand-in for face-to-face. And so if a kiddo is grounded and they've broken house rules and you wouldn't allow them to go to a friend's house or have friends over during that period of being grounded, that the technology, the social technology has got to come away too. However, if kids are using technology to participate in their behavioral health appointments, as we have going on every day here at Northern Light Acadia Hospital, their primary care appointments, or navigating other healthcare pieces of their world, I would not recommend taking away the tablet and therefore essentially taking away access to the counselor, the therapist, or the provider. So we've got to draw some distinctions about what screen time is social and extracurricular, and what screen time is essential and medically necessary, and draw those distinctions there.
Yeah, thanks, Chris. We're going to need to be a little bit sensitive about time. We have lots of questions and, just a little bit of time left. So I'm going to stay with this theme here, Chris. If you could kind of comment on what is good advice on telling your child they are in quarantine and not able to play with their friends. My son thinks he is punished and he did something wrong. I feel awful both times I've had to tell him he had to be quarantined due to close contact. Great question.
Yeah, it is a great question. So it comes back to empathy and kindness, and recognizing that there's a loss that we can anticipate here, and therefore there are some emotions connected to grief like anger and sadness that we can also anticipate here. I also worry that some of this has gotten to a place of being connected to blame or shame, that if you've caught COVID or you've been subjected to COVID, therefore you've done something wrong. And so there's this unfortunate, I think, stigma that's developed that having COVID means I misbehave or I didn't do what I was supposed to do. And we've really got to work with kids and ourselves, frankly, on dispelling that and ending that stigma. And so being really clear, using the analogy of chickenpox or the flu or other illnesses that kids are familiar with. And when there is a risk of infection, here's what we need to do as individuals and families, and talking about our role as being a member of a community and how we keep ourselves and each other safe. I think kids will understand that language.
Thanks, Chris. That's very helpful. Cassie, I have a question that I think you and I will both try to answer. It goes something like this. Does anyone know if the oral medication currently being used in Europe have more or less side effects? So I'm assuming that, it's a question about the side effects relative to the two drugs that you talked to us a little bit about. I'll weigh in on it and say they're not approved in the US. They're undergoing trials now where they're looking at the safety specifically. These are complex drugs, and there are things we need to know about them because of the way they interact with the virus. We need to understand certain things. So I think that we're not going to see a release in this country until those kind of questions have been answered. So there'll be more to come. Cassie, you've been reading about this as well. What have you been picking up on?
So it looks like the FDA is having an emergency meeting on November 30th to consider the use of molnupiravir in the United States. I'm Canadian, in the United States. The side effects so far listed by Merck are none. That in the UK, the clinical trials that have been applied in the short term reveal no side effects at all. This drug has been studied for over 20 years. It was initially developed to be used for the influenza virus. And so there is some differing data out there on short and long-term side effects as applied to the influenza application, not necessarily COVID. So the data is limited when applied to COVID, but so far no side effects are listed. Paxlovid has not been used with humans yet in like a large way. And Pfizer has released, once again, no side effects listed. It is a combo drug though. And so one of the two components has been used to treat HIV. Specifically, it's a medication that is used to prolong the length of activity of the other drug that it is paired with. And so in its applications in HIV, it has been seen to cause some GI toxicity, specifically nausea and some diarrhea.
Mm-hmm. Yeah, so I think we're awaiting like the information from that November 30th.
Yes.
You know, I think it is something that we want to pay a lot of attention to, but it doesn't derail us from the primary message of vaccinations, boosters, masking, distancing. I know we're starting to repeat ourselves just like we did last year. So here we go. Jackie, this one's for you. When will the definition of fully vaccinated change to reflect if individuals have had a booster? This has been adjusted in some EU countries. I don't know if you've come across that. I haven't.
I have not either. And I think, all vaccines undergo studies and research and data collecting and then changing and shifting guidelines. For example, the varicella vaccine that was developed years ago, initially it was a one-shot series. And then several years later, it came out and said, no, they need a booster between 4 and 6. I think that data is going to continue to emerge and evolve. And I think for now, what they're doing for research is just going to continue to dictate when, where, who, how, and ongoing information regarding the COVID and the booster vaccines themselves.
Yeah, well, it certainly seems clear that what we were very comfortable with as fully vaccinated is today in the process of changing by definition. So yeah, more to come on that. Cassie, I'll work with you on this one. There is a semi-quantitative antibody test with results that range from 0 to greater than 100 rather than the simple yes and no. Does this number correspond to the percentage of coverage that the vaccine manufacturers discuss or claim? This is available to both children and adults, ARUP and other labs, and seems to be used in other countries to determine how a vaccine coverage is waning. So what's your take on that?
So the idea is, you reach a threshold of effective antibody titers. Is I think what the question is asking is, do we have an idea of, like, instead of yes or no, is there a gradient of acceptability? And the data that's being so what we're using here in the States data-wise is a yes or no, not a sliding scale like is being applied in Europe. And I think in part it has to do with the availability on a widespread scale for this test to be applied. Dr. Gilkey, is your experience different than that?
Yeah, I think what I've been reading about is very similar to that, in that there's not really a clear-cut threshold. It really is a difference between people to some degree. And so we're still learning about that. Like, how do we actually know? Like some of the testing that we do in the world is, if you have antibodies, then you don't need to be vaccinated. That's not going to be the case with this. We're probably not going to be chasing with antibody levels to know whether somebody should get a booster or not. I think boosters are here to stay, and we just need to figure out what the timing and whether we have to adjust to new variants. I'm going to just rush through this last question that came up. Can you please review testing protocols? How long should one wait to be tested after a COVID contact or potential contact? I think the rule of thumb right now is you could be tested immediately after contact. It'll probably be negative. You're not really negative until you test within the 5 to 7 day post-contact window. And I see Dr. Muldoon agreeing. So I think we've answered that one. And there's more information, testing protocols with surveillance and everything. That's another whole story. So we'll have to save that for another day. I'm going to have to wrap up now. We have included some excellent tools for you at the end of this presentation, as you can see on our slides. Thank you all for joining us, and thank you to our panelists. I hope this hour has been a help to support you, your employees, and our communities to safely manage through this pandemic. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on December 2nd. We'll be discussing the latest on COVID-19, the holidays, mental health, and substance abuse. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together to promote good health, we will be promoting good business. Thank you. Have a safe and happy Thanksgiving.